So let's talk about these, what I call, I think it's most properly called experimental biological agents. You might hear me use that phrase. Definitely you should not be calling this the COVID-19 vaccines. The reason is, whatever you call it, it's experimental. It's not been approved as a vaccine. It's currently in its investigational stage. It's been approved by, I don't want to misspeak, the FDA, I assume, is the one who would approve it, but it's in an investigational stage only. AstraZeneca, Pfizer, Moderna, and Johnson & Johnson. That's very important legally. If you were to be injured by something and it's an experimental stage, it's adjudicated under a particular standard. Pharmaceuticals who manufacture these experimental biological agents are immune from all liability. So this group probably knows that, but I'm not saying that they have a negative motive. I think mostly they have a profit motive. I'm not saying they're trying to hurt people or kill people. What I am saying is that if you know that you could be sued and pay out millions of dollars every single time something goes wrong, you're really, really careful, okay? You're a little less careful if you know you're going to be shielded from that liability, and they're completely shielded. So when people ask me, am I going to take the vaccine? Would I recommend my children take the vaccine? I said it's really irrational to take a brand new, untested, untried technology from a company that's completely shielded from immunity. When on the other hand, I've got a drug that's 65 years old, has been given billions of times, completely safe for all age groups. So what are the potential problems with this experimental biological agent? The first, most obvious, is that this is brand new technology. The first two that are coming to market use something called mRNA technology, which has never, ever been used before for vaccines. This is when you hear a lot of the more kind of concerning and flamboyant issues, it's because people are very worried that this is brand new mRNA technology. I don't really go down that path, but what I can say is I don't really want to be the first person to take brand new things when it comes to medicine, right? You don't have to be a genius to say that. So that's problem number one. Problem number two is there's been a tremendous failure of previous coronavirus vaccines. This is not well known, but there are multiple coronaviruses out there. So prior coronavirus vaccine attempts have been made. They have failed. They can't do it safely in human beings. And I'm going to talk more about that later. But just note that we've not been able to successfully overcome the human bodily hurdles that making a vaccine against a coronavirus has put up. Number three, there is no independently published animal studies. One of the companies says they do have animal studies, but they haven't published any data on it. There's been a complete rush to put this to market, and you simply cannot do this safely without published data on animal studies, because animals often will die at the end, and unless we know that, we don't know if it's safe to give to humans. Okay, problem number four is known complications. One of the most commonly known complications of vaccines is something called, big science words coming up, guys, antibody-dependent enhancement. It's also sometimes called immune enhancement, and it's sometimes called pathogenic priming. What this is instead of really causing immunity, it causes a person to overreact in a negative way if they should ultimately be exposed to the virus. This thing called antibody-dependent enhancement or pathogenic priming, although you haven't heard of it, is well known to scientists. I like to say it has its own Wikipedia page. This is not fringe. This exists, and this is real. The biggest problem with antibody-dependent enhancement, we see this with prior coronavirus vaccines. So when they were doing the studies with SARS-CoV-1 vaccine back in 2005, they came up with a vaccine, and they gave it to the ferrets, and it was 2-dose like the ones today, and the ferrets did fine after the first dose. They did fine after the second dose. Later, they exposed them to the coronavirus SARS-CoV-1 in the wild, and the ferrets died. That's why SARS-CoV-1 vaccine never came to market. Antibody-dependent enhancement. You can find all the information I'm discussing on americasfrontlinedoctors.com, vaccine information. Also, I'll get to at the end at the stopmedicaldiscrimination.org site. It has it there as well. Everything is well footnoted and referenced. So known complications include antibody-dependent enhancement and also some of the things you've seen in the news, like neurologic problems, like transverse myelitis, Bell's palsy, Guillain-Barré, et cetera. Those are known complications with vaccines that already exist. There's also a lot of issues with unknown vaccinations. I think what's going wrong on the other side is a complete lack of respect for what you don't know. We don't know what we don't know until you discover it. I mean, these are the things parents teach their children. They don't know enough, right? So what are the potential unknowns? Well, something that I learned this year, actually in the last few months, which I was shocked because I never saw this anywhere in the newspaper, and I'd like a show of hands from anybody here who's heard of this before my mentioning it. Has anybody here heard of potential fertility problems with this vaccine? That's amazing, you guys. I did not know this myself until about maybe 2 months ago. So I had to look into it. And by the way, the America's Frontline Doctors put together 10 doctors working for more than a month to put together all this research. So there's a question if this vaccine, a biological agent, I should say, affects this thing called the syncytial trophoblast, which is a layer on the placenta. Now, it does seem to do that when you're sick with COVID-19. The problem is that these mRNA vaccines kind of mimic having COVID-19 indefinitely. So while COVID-19 could be bad for the placenta and the baby if you get it like in the middle of the pregnancy, eventually COVID-19 goes away and you go about your life and then you're good. There's a question if this type of experimental agent does that same negative effect to the syncytial trophoblast layer of the placenta, and it would do it indefinitely. Scientists better than me, right? There's the 2 guys in Europe that were ex-Pfizer executives that complained about this and filed a petition with the European equivalent of the FDA saying you've got to not approve this as an emergency experimental vaccine because we haven't answered the question on the antibody-dependent enhancement and we haven't answered the question on the placenta. It hasn't been answered, that it's dangerous to release this. And you have to put that together with what is the risk of even having this problem. Certainly in younger women, right? Women under 50, the survival, we said, per the CDC, is 99.98%. For that reason, America's Frontline Doctors feels very strongly that you cannot even offer this to women of childbearing age. Now, what's going to happen if you give this vaccine to 100 million people that are otherwise healthy, and they do have this antibody-dependent enhancement reaction because we haven't ruled it out. They do get exposed to the virus in the wild, and 30% of them drop. And what if, for example, you've given that vaccine to all of your healthcare workers, and you've given that vaccine to all of your military and all of your police officers?